Hi, welcome to another. I was going to say an Instagram live, but it's going to be a similar Instagram, a kind of Instagram live YouTube chat with special guests, a very special guest, an acclaimed sexual health expert, a sexual wellness expert, a licensed psychologist, a certified sex therapist, and a clinical sexologist, amongst other things. Dr. Shannon Chavez from the United States of America, from Beverly Hills. Welcome, thank you. Assalamu alaikum.
Walaikum assalam. So good to be here. I always enjoy talking with you and yeah, getting to share my wisdom, especially on such a taboo topic. I mean, considering it's still taboo to this day that you and I are dealing with sometimes some of the censorship that happens as educators trying to spread this wisdom to the world.
Yeah. So just for the benefit of, 'cause I mean, the last time we spoke a couple of weeks ago from my institute, but the last IG live I believe we did was in March 2022. So it's been over 2 years now. It's been a long time where you educated us about love addiction and the work you do around that. But just for the benefit of people who are not familiar with you and the great work you're doing, do you mind first giving a quick high level elevator pitch in terms of who you are and the work that you do?
Yes. I'm, so grateful for the work that I do. I'm a psychologist, but I'm a certified sex therapist. And for those that don't know what that is, it's someone who specializes in sexuality of all forms, sexual health and wellness, sex education. I primarily focus on work with adults. And as a therapist and licensed mental health professional, I'm really integrating the world of helping with mental health and understanding sexuality at all stages of life. So I have a private practice here in California where I work with therapy clients, individuals, and couples, many couples, and also starting to do some group work, especially for women dealing with endometriosis. And I also offer virtual care. So that's the great thing about technology. I can now work with people all over the world, and I use mainly my modality of consultation and coaching for people outside of California. And that has helped me, provide resources for people all over the world who may not have access to therapy. And so I kind of think of myself as an expert in all things sexuality, anything from sexual health and dysfunction to just generally wanting to understand your sexual identity more. So I love the work that I do. It's never a dull day in the office, and I think we need sex therapy more now than ever in our world.
Lovely, lovely. And I understand you are a certified sex therapist with the AASECT, I believe. Do you mind explaining what that is?
Yes, and I do think that's important for people to know. Someone that does become certified in sex therapy, we go through a very rigorous training. So, what's great about training in sex therapy is that you do your own individual work as well. And I found that very valuable. So, we go through our own training to kind of reassess our own values and beliefs around sexuality so that when we work with diverse populations, that we are going to be able to provide a safe and judgment-free space. And ASECT is the American Association of Sexuality Educators, Counselors, and Therapists. So they are one of the professional organizations that does certify mental health professionals in sex therapy by developing what criteria certifies a sex therapist, our continuing education requirements to continue being a sex therapist in this field. And ASECT also certifies educators and counselors and people from all professions. Actually, many medical doctors now are getting ASECT certified, which is wonderful. Dr. Loki, I believe, she's also an intimacy counselor. She's doing great work with sexual health. She's a Muslim medical doctor who's also certified. So that's great to see people getting the program and training to be able to do this work.
Lovely. And I forgot to mention, I know you alluded to your online videos. You've also got a YouTube page. Can you just tell us a little bit about the name and where people can find it and the type of content that we can find on your YouTube page?
Yes, I am branching out into the social networks. I've always really admired YouTube, so I've been starting to dabble in YouTube videos, and of course, dealing with some of the censorship as well. My YouTube is at Dr. Shannon Chavez, and mainly my videos are things that I feel are common questions that many people have. Um, even about sex therapy, general questions that I hear from a lot of my couples that I work with. How do we deal with uneven desire? What happens if we're just not interested in sex? So I'm taking from my practice and my experience, what are common things that people are struggling with? I want people to be able to use my YouTube page as not only a resource, but a safe space to get a clinical perspective, to get a conversational perspective, to make sexual concerns more approachable. Because I find that they're either often stigmatized or pathologized, where people can feel a lot of shame and embarrassment by having some of these common issues. So my YouTube is a place to say, hey, we all kind of deal with these issues no matter where we're at in our life. Let's have a space to talk about it. Here's some insight into how I might work with it as a professional, and hopefully getting more insight from followers on YouTube of what people want to know about. That's always why I love the social platforms, is give me the questions, let me know what you want to know so I can share my knowledge and wisdom.
Wonderful. And apologies if this is going to sound like a silly question, but what is the difference between sex therapy and intimacy coaching?
Yes, great question. So, sex therapy is a form of psychotherapy, and therapy follows a very clinical model. We look at assessment of past, present, and also future oriented goals. We're looking at full medical, mental health history, and therapy really focuses on looking at how the past impacts the present. We're looking at behavioral patterns. I'm very focused in my psychotherapy on attachment oriented therapy, which looks at how our early relationships impact our present relationships. Intimacy coaching is very different. It's very solution focused, it's very current focused. We don't really look at the past. It's not like a therapeutic model. We still assess, but I find that most of my intimacy coaching clients are coming in, they want advice, they want resources. They may have just a very simple question. How do I use a vibrator? What type of lubricant should I use? How do I talk to my partner about this? So it's very different than what we might do in a therapeutic model, which may be a bit more long-term in some cases. So we are using more of a progressive model in therapy to kind of focus on, building a plan and working towards particular treatment goals, where coaching could sometimes be one session. I've actually had a lot of great clients that come in for just a refresher, 1 to 2 sessions. They're looking to revamp something in their life, or they want to explore something new. And so coaching can be very collaborative and solution focused and resource based. So coming to a professional like myself to just get some insight into improving this or trying that, which is also a bit integrated into the therapy model as well. It's just more specific towards common current issues that may be going on for that individual.
Amazing. And then just another one, again, apologies because I was going through your website and again, you offer many services from therapy, coaching. There was another type of therapy that I wasn't familiar with. I was wondering if you could educate us on concierge therapy. What does that entail and how does that differ from sex therapy, if there is a difference?
Yes, this is actually a new service that I'm starting to offer. And basically, it came from working with a lot of clients that the traditional therapy model wasn't working for them for many reasons. Maybe it was, we've tried that and it hasn't really created much traction or change, or wanting to do something out of the office. So I started with concierge work, doing things like personal retreats or couples intensives, which may be something like a half day to a full day to even a weekend of immersive work. And sometimes this works better for clients because it creates a different level of accountability and commitment to the work. It can be very personalized and tailored to the couple who may say, we're in crisis, we really want to dive in deep, and weekly therapy might not work for us right now. So concierge is really my ability as a professional to tailor and personalized treatment for that individual or couple. And two of my services within concierge, which I'm very excited about, are doing in-home assessments and treatment and bedroom reassessments. As a psychologist, I'm really fascinated with our space and the way that we live and how that impacts everything from our mood to our health to our intimacy. So in the concierge work, being able to go into a client's home and really see how their lifestyle is, how do they feel in their space, how comfortable do they feel in their intimate space, whether that's the bedroom or wherever they find space to make connection with themselves or a partner. To me, that gives me a lot of insight into their psychology. So concierge kind of allows me to do something a bit more unique and kind of modernizes the therapy approach as well. I think a lot of people post-pandemic were ready to get out of the office and they want to try new things. I will mention in concierge work, I also do things like walk and talk therapy. So with particular clients, I've met them on a hike or beach or outdoor setting where we can really use the elements of being outdoors to do more mind-body work. And that may be mindfulness training, embodiment work, using nature as a wonderful landscape to be able to do therapy. And it's, very relaxing. It's great for nervous system. So I get very excited about concierge work because I'm also ready as a psychologist to see my field evolve a bit more and offer more services that are going to help people that may not be the traditional, weekly therapy model or, some of the other models that work well for some clients, but for others are looking for something new and different.
Wow, amazing. You wear many hats:
Yes.
educator, psychologist, therapist, sexologist, coach. Which of these, and they're all different, I understand there may be some overlap, but which of these hats do you enjoy the most and why?
I would probably say educator. That comes to me first because I think no matter which role that I'm in, education is such a big part of that. You can't do
Mhm.
therapy or coaching or any of these types of modalities without education. And also, just the general fact that many of us don't have sex education. So I don't think people would actually think, I'm going to go to a professional to get educated around sex, but they may go in to speak to someone as a therapist because that's sort of what's normalized more. I think many adults feel shame not knowing these things about sexuality. So I get excited wearing the hat as educator. And, I get to use some of my tools that I actually have here on my desk, my vulva puppet and clitoral models and really helping empower people through education. And I've seen so much healing happen through education. I've seen clients come in after one session and go, whoa, my mind is blown. I didn't know this. Or why are they not teaching me this? Or how have I had 3 children and I never understood my reproductive cycle? So there's just incredible healing and insight and confidence building that can happen from educator. And I think as an educator, I get to reach a lot of populations as well. So for some people, especially coming from my culture and many of the, friends and family that I have, therapy is still very taboo. So being an educator and being able to go into a speaking event or create a video where I'm teaching about general things to know about sexual health and wellness, that can change people's lives. So I'm really inspired to do more of that work. And I also believe that not everyone needs therapy or coaching or one model, that we can really figure out how to reach people and provide them with what they need, no matter what the modality.
I agree with that. That's beautifully well said. Just wanted to touch on something you mentioned about, is it some people in your culture, because therapy is more, maybe there's more stigma or taboo around it. So would people more be comfortable to speak to you in the frame of you being an educator or a therapist? Is that what you were saying? Or is it the other
Yeah,
way
I
around?
think, generally in my experience, even getting into this field growing up, I remember even my grandmother saying, why would anyone want to do that work? Why would you go to a therapist? Why wouldn't you go to your family? Why wouldn't you talk to your priest or any religious leader? And, I grew up in a very, very conservative Catholic home. So, therapy just wasn't normalized. And it's starting to more in the Latino community, but there's still a lot of stigma around it. There's still a lot of judgment around what it means to seek professional help for mental health or the minimizing of mental health issues that leave a lot of people isolated and not getting the help that they need. So I think with being an educator, just talking about that, I know I'm starting to do that more for the Latino community, just to talk about the fact that yes, it's been taboo and it's still difficult for many of us to get the help that we need, and to talk about that as an issue is important. And also, there's less than 1% of sex therapists that are from a Latino background. So we also have a big gap in cultural competency and being able to work with individuals or professionals that understand the culture, that understand the background. And that's a big niche of my work, is working with conservative cultures and backgrounds. So I'm also a Muslim convert. So I feel like religion has been a part of my life, entire life and career. So I understand it from so many angles. And I want people to also be able to work with a professional that understands those values. I think sometimes people think of sex therapy and they think, oh no, I'm going to go to a therapist and they're going to make me do something outside of my comfort zone, or they may not, I may be embarrassed to talk about my faith because they may not understand that. So I want people to understand the integration of the two and to be able to meet people where they're at. So breaking those stigmas and just giving people what they need, tools, information, anything, permission, a lot of the times, permission to just be able to talk about some of the struggles that, I keep saying we all have, because we all will have these concerns no matter where you are in your life, that it's not a dysfunction or something to be ashamed of.
Oh, amazing. And just again, I've said this before, but I'll say it again. Dr. Shannon Chavez is my go-to favorite sex therapist. One I highly recommend. And the reason I've said this to you before, but I'll say it again. The reason why I appreciate the work that you're doing is because you've come from like you said, a Latino background in the US as well. So you've got, and obviously the experience that you have being a Muslim. So you see things from so many different perspectives in addition to your professional training and experience. And you bring a nuance and a relatability when you're even giving your videos, and even like when I've read some of your articles, you're everywhere. I mean, people should could just Google her name. She's been featured in the Huffington Post. She was even on a Logan Paul's podcast. So she's everywhere. But honestly, I do appreciate the work that you're doing. And I think there are many people, which I'm sure obviously you're familiar with, in conservative communities and religious communities who require and need the work and the services that you're providing. And I just think that you're definitely a valuable resource. So I would definitely want to obviously just let you know that, just to continue doing what you're doing, because your work is very much appreciated. And that's why, again, I wanted to definitely make sure we platform you and amplify your voice and your work that you're doing, so people who are struggling can go and access like the services that you're providing, because like I said, I think you're valuable. So I just wanted to say that. Um, you mentioned, I wanted to touch on sexual shame. Can you help us
Yes.
understand or explain what is sexual shame, and if there are maybe a few tips to help reduce sexual shame?
Yes. I mean, sexual shame is so prominent. I don't think I meet one client that doesn't have some level of sexual shame. And that can be, your beliefs, your thoughts, your perceptions about your own sexuality. And that can be anything from your identity to your interests, your desires, even your fantasies. I have a fantasy that I think about that makes me feel like a horrible, wrong, bad person. I think shame is influenced by so many things, particularly culture and religion and society. So that's why I feel like it's so prominent. We are all going to experience shame at some point, because we want to remember shame is not something we're born with. It's a learned behavior. So we learn to perceive ourselves in this way. So it's important to understand the environment that we come from. A lot of the times in sex therapy, I start with values and beliefs around sex. So we really assess that. Where did you learn these messages? What was it like growing up? What were some of your first resources around learning about sex? Did you see something on television, a song? Was it something that an elder in the community mentioned? So sexual shame can develop in so many different ways, and it's very repressed in our psyche. So many of our sexual shame symptoms may not show up necessarily as cognitions. They sometimes show up as body-based reactions. I see that a lot with sexual functioning. Also, the more we repress it, the more we may feel mental health concerns, depression, anxiety, fears around sex. So it's such a big issue. And also, I think, not that it's simple to address and treat, but I always say the simplicity comes from talking about it and naming it. I've seen so much healing happen from just being able to say, yeah, that's made me feel really bad. Or I grew up in this good girl syndrome where I felt that, things were either good or bad. And I've been navigating that my whole life. So I think that can be, just naming that and permission to talk about it has been an incredible path for healing sexual shame. And you can do it at any age of your life. I don't think it matters how long shame has been prevalent. It's the fact that you are giving yourself permission to address it, naming it, and processing that shame. Most people have never talked about these feelings before, which is why I feel so grateful as a sex therapist, to hold that space and provide safety for people to name it. I don't know how many times I hear, I have never talked about this to anyone. So I feel so grateful for that, because to be able to be that safe space and for someone to feel safe enough to talk about it for the first time in their life is a tremendous thing to do for yourself.
You mentioned something, I was just writing it down. Good girl syndrome. I've never heard of that. What is that? If you can
Yes,
expand.
it's a very prevalent term we use in more conservative religious communities. So good girl syndrome is kind of growing up with the idea of these very black and white beliefs around sex. This is bad, this is good. Avoid, abstain, some of these messages sort of imply an identity that is more acceptable. The good girl doesn't break the rules. And I mentioned good girl versus good boy because there tend to be more messaging towards females around uh, how they should address or approach their sexuality than boys. It can be very similar, but I feel that the good girl syndrome is much more prevalent in what I see in my work in terms of how females are raised to understand or even avoid or be afraid of their own sexuality. So the good girl syndrome is, good and bad, things to avoid, what to abstain, and it leads people to feel that there's not a spectrum around sexuality. So I'm either, following the rules or I'm not. And it leads to a lot of sexual shame. It leads to lots of sexual concerns later on in life and even psychological trauma because it leads to beliefs about oneself and their experience that can be detrimental to their well-being. And so it's something that I find that when we name it, and they understand what it is and see also that it's a common experience that many females have, it can normalize it in a way that helps that healing path start much more effectively. So many will say, yes, that's exactly how I grew up, or yes, those were the messages. And, my brothers didn't get that message, but I got that message. And I felt so much shame about being a woman, or I was afraid to go out into the world because of how I was programmed to believe my sexuality, was a risk or was, something that I needed to be so overly responsible for. And, some of those messages can be just a bit too extreme that lead to, very black and white or cognitive distortions in our thinking.
There's another term actually that is often bandied about. I wanted to ask you about narcissism. What is a narcissist and how prevalent is it a disorder? Like how prevalent is it? Because I often hear people, will call someone like a narcissist or the ex was a narcissist or their partner. I'm just wondering how common is it or how prevalent is it and what is narcissism?
Yes, I mean, pop culture loves to throw around the term narcissist as if it's, a way to validate one's feelings. But narcissism, from a psychological perspective, is much deeper than that. I've actually found in my work that it stems from a lot of childhood trauma. So, childhood trauma of unmet needs, neglect, being raised also by a narcissistic parent. Narcissism in psychology can be considered a personality disorder where there's a cluster of symptoms that we use to assess and diagnose. And they can be things like a grandiosity of self, sometimes lack of empathy for others. So what I've found is that sometimes it's kind of a disconnect from their emotional self. And so it's this grandiosity or mask that an individual may have in order to function in society, but also to protect the wound itself. A lot of narcissists actually don't enter therapy, which is interesting. But if you do get to work with a narcissistic personality in therapy, what you'll find is that there's a lot of masking and hiding of that that wounded self. So if you can kind of get to the wounded self and validate that early experience of trauma, there can be really incredible healing that can be done. But most narcissists have such an armor around them, they may never go to therapy. They may feel sometimes they're very much about external blame, these or victimization. These things are happening to me, but not as a result of me. So it can be very hard dynamically. I've worked also with many couples that one may be have more of the narcissistic personality, so they're functioning in this dynamic of unmet needs or even emotional abuse in the relationship. I've seen it with sexual abuse as well, working with more out of control sexual behavior. But again, it's used a lot in our pop culture to understand certain personality types, but I do have a lot of empathy at times for narcissism because of that early wounding. So I feel like it almost develops like a defense mechanism for dealing with the early childhood wounds that were not necessarily addressed.
Oh, interesting. So is it so can someone be a narcissist without realizing it because of what they've gone through in childhood? Is that like is it
Absolutely.
out of their control? Is it kind of like
That's why I call it a coping mechanism, because it comes out of learning to function in an environment with unmet needs, and that can lead to a lot of psychological issues, whether it's substance use or behavioral issues and disorders, or narcissism as a defense is sometimes how this individual learns to get their needs met. That's why narcissists at times people will say, oh, they were so charming and they were the best person in the world. They put me on a pedestal, and then they started with the behavior that was more abusive or coercive. And so I think that's why it can feel traumatic in a relationship. And I think if we look at it from that early trauma, we're able to understand that this person may not be aware consciously that they are doing this, or they've been functioning like this for so long, it's been normalized somehow in their environment because of those wounds or inner core beliefs. So it's a lot more complicated than it is not for us to use it as like a blanket term when we don't like someone's behavior, or we feel that someone is, maybe, expressing more grandiosity. I would say it's important that we assess it appropriately. That's why when I hear people throw the term around, I think, we may not be that, but let's, especially in therapy, let's see if that's really the case. Let's assess appropriately, which is why it's important to work with a mental health professional who can appropriately diagnose and do that to be able to figure out how to address it and how to move forward.
so again for people who are throwing around the term first, as Dr. Shannon said, it needs to be assessed by a mental health professional like herself, someone like herself. We shouldn't be quick to throw around the term like narcissist. And is that also similar to addiction? I know you've done a lot of work around addiction.
Yes.
Would you advise or not advise people if someone has, like you could say, maybe a habit to watch porn or their partner is that a healthy term to use around, or like what's your thoughts around using the term sex addiction and porn addiction or love addiction for that matter?
That's a great question. Just like narcissism, sometimes people self-diagnose. So if it helps someone understand their own behavior, that can be a gateway to getting the right help and resources. But if you're using it as a way to excuse behavior or to continue abusive behavior, that I think is, again, not addressing the actual problem, and maybe, again, blanketing over what really needs to be addressed or changed. So I think, addiction is a very general term. That's why I see it, used in every which way. I mean, people say, I'm addicted to chocolate, or I'm addicted to this or that. And I think it's important for us to understand what that means. Of course, in my work around addiction, I found that, anything can claim our consciousness. So of course we can add anything to that, work, sex, food, but to understand it in terms of psychology, it's important to see how it functions. Not all behaviors, sex addiction is a good one. Not all behaviors have addictive components. Sometimes they function more like an anxiety disorder, or they have more mental health components than they do profiles of addiction. So if we kind of put it all under one category, people might not get the resources they need. They may get misinformation on what to do with it or how to work with it. And I think especially in coupleship, when we had this explosion of sex addiction in our society where it was, on every news channel, rehab centers popping up, I think there was even spouses that were saying, yes, that's my husband's problem, or this, send him to a sex addiction clinic. And we were just getting a lot of people seeking treatment, not knowing why. And I think it needed some recourse and change for people to get the right help. And that's what
It is.
spurred my research in love addiction. I was inspired by that. I'm like, wait, everyone can be a sex and love addict, or, if you love too much, does that make you an addict? And so I really used my work to find a more therapeutic model to work with it, and even assessing something like love addiction or sex addiction from less of an addiction model and more of an attachment oriented or psychotherapy model. And so that's what spurred my interest in that topic in the first place.
And was your PhD on love addiction? I saw your blog, your article on that.
Yes, yes, I did. I actually created an attachment-oriented psychodynamic therapy model for treating love addiction. So I said, let's actually look at it from the lens of attachment theory. And for those that aren't familiar with attachment theory, the simple way to understand it is how we were loved is how we love. So how we had our needs met early on in life really creates working models or programming to how we seek that connection in our adult lives. And that can be everything from friendships to romantic relationships to career relationships. Every social connection in our life is influenced by our attachment. So there's ways to assess your attachment, but also I think with love addiction, I look at it as an attachment disorder. There was trauma in early life that led to maybe changes in those pathways that either created anxious or avoidant or disorganized ways in which people get their needs met. And that sometimes can lead to things like compulsions or anxieties and fears that often put people in unhealthy relationship dynamics or may lead to other types of risky behaviors. So if we look at it from that lens in terms of my model that I created, it shows that if we heal attachment and create a secure place for that healing to happen, it can resolve these behaviors and patterns that people are using to meet or fill voids from their early life.
Yeah, you're blowing me away because again, it just shows how it's not as straightforward as what we see in popular culture, the way people talk about things. There's a lot of nuance and complexities to these many of these diagnoses and these personalities that you're speaking about. I'm just wondering, with the work that you do, depending on your client, forgive me for this expression, do you have to like dumb things down for some clients more than others? Because it's like it's not so straightforward as, and I'm glad you're educating us, but when you have someone who maybe what you're saying sounds too complicated, do you have to like dumb down the message, or like how do you deliver? How much trying to word this in a case of what you're saying is great and it makes sense. But I'm thinking someone who thinks this is too complicated, they just want an easy solution. I want to say that my partner's got this problem, or how do you work with someone who just wants like a simple ABC answer? This is what the problem is, or do you come across those issues?
Yes, no, that's a great question because every client is coming from a different background and even different language. I learned this really on in my work because I remember I had an assessment form, a sex history form, and I was very proud of it. I'm asking all these really important questions and I couldn't wait. And I didn't think about that. And I remember the question that made me change this was, do you have erotic dreams? And I was working with such conservative populations. They said, I have no idea what you're talking about when you ask about what's erotic, what do you mean erotic dream? And so I had to really think about that, to simplify the way I'm assessing general concerns that I imagine many people have in ways that the language was understandable, the problem made sense. So I've really tried to make it an approach where I meet you where you're at. And even in my assessments, I'll ask the client to put in their own words how they would describe their sexual concern. And what's helpful about that is, they're not checking a box and saying, I have dysthymia or this, all these, clinical terms, but they get to say, it hurts when I have sex, or I'm not interested or attracted. And so meeting them where they're at and seeing their language to describe what's going on helps me meet them where they're at. And so oftentimes, yes, clients will say, they're not coming from a clinical background. They may not know what I mean when I say attachment. So I want them to understand it from the experience that they've had. And we'll talk about it. And so I do really try to help these concepts feel not only understandable, but simple enough to be able to apply them to your day-to-day life. Not just be an interesting theory in therapy, but it's something I understand now enough to know I can go home and bring this concept or approach into my own life, or have that aha moment and say, okay, this is why I've struggled for so many years. So yes, that's a great question, because that's such an important part of sex therapy. And I don't want people to be intimidated by sex therapy, thinking that they're not ready to enter the work because it might feel a bit too overwhelming or complicated. Many of my clients will say, I've had no sex education, or I have no idea what my anatomy is called or what these things are. So that's why the educator hat is all my favorite hat as well. Like, let's pretend we don't know anything and we're going to just build up from the ground up and create a toolbox, awareness, language. And also I encourage my clients to bring their language into therapy. What do you refer to these parts? We don't have to use overly clinical terms, but we don't have to use slang as well, of terms that might feel really uncomfortable to use when describing sexual function or sexuality. So that's why I say it's very personalized work that I do. I don't have any cookie cutter model that I use in therapy. I really try to meet the client where they're at and make it a safe and comfortable environment and fun. I know a lot of people don't think of sex therapy as fun, but I do try to create a space where people can feel encouraged and empowered and excited about sexuality, even if we're healing with some, very serious issues. I think that's part of why sex is so taboo. It's looked at as this very serious, thing that we experience, and we've kind of taken the fun and pleasure out of sex. And so I want people to understand sex therapy can be a balance of those concerns.
Lovely. And your mind body, I think it's your mind body model or approach to wellness. Can you talk a little bit about that?
Yes, I'm very passionate about that. And I think that also comes from being in, this field of psychology and realizing that, there's some flaws in our psychology model, in terms of assessment and diagnosis. I think looking at, strictly, thoughts, behavior, and cognition, and not incorporating the body is so limiting. So mind body to me is a holistic approach. Let's understand the interconnectivity between all elements of our being, whether that's our mind, our emotions, our spirituality. It's all connected. And I think that in my personal life, as well as my professional life, going through, health concerns, I've realized that you can't address one without the other. So as a clinician, I want to look at that from a more holistic view. And we now know, I saw a funny meme the other day that was a therapist talking to a client saying, have you slept well? Have you eaten today? And the client is describing, distress of the day, and I'm so anxious. And it's the little things like that, looking at nutrition. Are you exercising? When's the last time you went outside and had a nature walk? These things impact our psychology and mental health so much that I don't want that to be minimized in my approach to therapy and psychotherapy. I would like there to be an integrated model. And I actually started my career working in an integrated clinic. So I was able to work with a gynecologist, a pelvic floor physical therapist, and a massage therapist. We had a women's health clinic, and seeing how all of our disciplines came together, I never wanted to work in another model. I said, this is great. This helps people address it completely, rather than, go to this specialist for that and then start this work over here. Many of my clients have done that, and it's been not only stressful but overwhelming. So mind body to me is we're working on everything. And I make a lot of referrals to other professionals. It could be a urologist. It could be, I send a lot of my clients to holistic nutritionists if they need to work on gut health. I'm very fascinated with gut health because I don't know if you know this, but most of our serotonin is produced in the gut. So when I see people dealing with depression, anxiety, I always want to make sure we're addressing gut function. How is your body? So it won't be surprising if you're in sex therapy and I'm asking, how are your bowel movements? Are you eating regularly? When's the last time you had a physical? Those are all things that I want to make sure people are connecting with what may be going on in their mental health. It's not, they're not separate entities. So I think it's important for people to see that interconnection.
So, from what I've understood, so sexual wellness is not just about the act of sex, because I think oftentimes some people, when they think about sexual wellness or sexual health, it's just the act of intercourse. Is that not the case?
Yes, it's so much more than that. I think, people having that limited view may not realize the extent of sexual concerns that we may have. It's body image, it's intimacy skills, it's your education, awareness, and ability to communicate what your values and beliefs are around your sexuality. So it's so much more than that. And, I think that's a big problem nowadays in our culture, is that we see sex as this mechanical thing that we're either having or not having, and we miss this entire potential to really explore and understand our sexuality. I mean, sexuality is about energy, it's about connection, it's just a form of social connection. So it's interesting that we think of it so mechanically, because it's just as important as the relationships we're building, what we're passionate about. And also expanding that definition. I think pleasure, is just starting to come into the conversations around sex. And that's so surprising to me. Why have we not been talking about pleasure for this long? Why do people not understand that feeling good is a part of sex, not just genitally, but fully, feeling good fully in your connection with self or partner. So yes, I'm very passionate about changing people's mindset about sex just being intercourse, or it's just about these acts or mechanics or functions. And even understanding sexual wellness is much more than just sexual health. Wellness is really, how are you taking care of yourself? How are you regulating? What are you doing to understand your sexual function throughout different stages of our life?
And you said you're passionate about changing mindsets. If you could pick one mindset change around sex that you could change people, what would it be?
It might be just that, changing this very narrow definition of sex, because I think when we do that, it not only feeds into the stigmas and beliefs, but it limits people from our sexual potential. And what I mean by that is, sex is meant to be playful and creative and ambitious. And because we don't have that definition that can be that each person can identify with. If we see it at this mechanical definition, people may say, that's not what I see as sex, or I'm not wanting that. I think changing that mindset to help people see, well, wait, I can design that. I can come up with my own understanding of what sex is. Even something as simple as, I always challenge my clients, is kissing sex? Well, no, kissing is kissing. Kissing is not sex. Well, what if kissing is erotic and passionate? And what if it creates some of those feelings? Then we start to expand that definition. So I definitely think it would help heal a lot of shame around sex. I think it would help meet and improve satisfaction around sex. And so that's the mindset I would love to work on. And I do that in my practice every day. You can ask any client I work with, they would say, oh, she's always challenging our definition around sex and wanting us to expand past that. But it's so important, especially in individual work, but as well as couples work, because now you have two different perspectives that you're working with, trying to create a balance in terms of understanding, empathy, and communication. So very important to work with that.
And in your experience, do you find, or have you come across couples who have different understandings about sex and intimacy, like where one partner may be referring to intimacy, not referring to the actual act of sex, and the other partner, when they hear intimacy, they feel it, thinking it's intercourse, or like, do you have those challenges? And if so, how do you try and resolve those?
Yes, I would say 100%. I can't think of one example of a couple that may not have those differences. And I invite that in because it's hardly the case where we'll meet a couple that has the same perspectives, even coming from similar backgrounds. So it's so important that we normalize that. And that's really the work that we do in sex therapy. It's not about making one person right or wrong or adapting the other person's mindset. It's more about, how do we learn to develop sexual empathy, which means I can be curious, I can help to understand where you're coming from, and that we can create a balance of meeting those needs, even though what you need may not be what I need. And that's very much the case, I think, with any coupleship. Hardly would we say our needs are identical, but what we learn to do is navigate meeting other people's needs as well as taking care of ourselves. So that goes to that's what we do in our sexual life as well. So it's important that we have that balance. And most of us just never learn sexual empathy. Most times when I tell a client that term, they go, "What is that?" I know empathy, but what's sexual empathy? It's just bringing that same ability and skill to our understanding of sexuality, even if it bothers us. And that's the biggest thing that I see. People may say, "Well, how can I give empathy if I don't like something that I'm hearing, or if I don't agree with that, or that's not my interest, or that's not my fantasy?" And I think empathy doesn't necessarily mean an invitation or a green light to explore or bring that into a relationship. It's the starting point of healthy communication for couples to be able to create a safe and judgment-free space to be vulnerable sexual beings. And most couples have never done that in their relationships. So it doesn't matter at what stage you're doing that, it's the skill building that becomes so valuable, to be able to listen, to reflect, to use your partner's words, which is an important part of empathy. Not to paraphrase and say, "Oh, you're interested in this really bizarre thing, but no, I'm hearing that this is what you like, or what you're curious about, or what turns you on." Incredible space for couples to do healing in that place of empathy and communication, just being able to talk about it without feeling triggered or embarrassed, or again, the shame comes in quite a bit that blocks our ability to get to that empathic state.
Oh, sexual empathy. I've never heard that before, but I love that, sexual empathy. And with just wondering, another topic I actually wanted to kind of touch on for you to educate us. I don't know if it's a clinical term, so please help us understand or define this term that I hear thrown about quite a bit. The concept of sexual repression. Do you mind explaining what that is, and can sexual expression repression, sorry, did I say sexual expression? Sorry, sexual repression. Can you define what is sexual repression, and whether sexual repression can lead to abuse?
Yes, that's a great term to understand, because repression can be repression or this shame or guilt around thoughts, beliefs, and values around sexuality. And that can create trauma for an individual to feel that who I am at my core is not okay. And repression becomes almost a coping mechanism. If I just ignore or disconnect or dismiss this part of myself, then I will be considered normal or healthy. And because of that, it creates almost this norm of what is healthy. I try not to use that term a lot in my work in sexuality, because there is no healthy. Healthy is subjective. So obviously we could say, there are things that may cross that line into areas of distress, or that lead to out of control or problematic behavior. But who's to say, what healthy is? For example, what's healthy desire? That is often a question I get from many people. So repression, I think, is based on what we've learned or what we know. We keep all of this kind of tightly wound up inside of ourselves, and that can lead to guilt, shame, embarrassment, maybe even rejection of oneself, or social situations that allow our natural sexual development, growth and evolving and confidence building. And when it can become abusive is when that's used in a coercive way, in which, repression, for example, in many communities is not uncommon, especially religious communities, where there may be very strong beliefs or misperceptions of those beliefs that lead people to perceiving that message as shame. As I mentioned with the good girl syndrome, right? I perceive that as, don't do this, or if I do this, I'm a bad person. So we embed that into our programming. And sexual repression, I've seen show up in very physical ways, everything from vaginismus to pain, discomfort, lack of arousal. I mean, the body definitely expresses that repression and shame and guilt through body-based functions, where that's why I think working in a mind-body way, it helps people understand, even though your thinking may change, that may be a programming that's still in your nervous system response. That may be something that's still impacting your gut and health in other ways. So it's important that we understand that relationship.
Sorry, you mentioned vaginismus. Can you, I mean, sorry, what is that? Can you explain what that is?
Yes, vaginismus is a very common female sexual concern, and it's basically involuntary contraction of vaginal muscles that can cause very painful intercourse or the inability to have any penetrative activity at all. And it can be caused by many things. Sometimes it can be caused by trauma. It can be caused definitely by lack of education. I've seen that be a huge factor where not knowing how sex works, for example, how to understand the arousal response can lead to that contraction and tension within the body. So I say it's a common concern because most women that have had pain with sex or a concern similar to painful sex or pelvic issues are sometimes diagnosed with vaginismus. So sometimes I see in the medical community an overdiagnosing of vaginismus where it might just be, as we're saying, trauma from the body or lack of information about sexual functioning. And again, the stigma around the term, making people feel a lot of shame around it. Something's wrong with my body. My body's, reacting in this way, or my body is turning on me and it's making, I having this response when I, am wanting to have, pleasurable sexual activity. So it's a very common concern, but also a very treatable concern. So I want people to know if you have vaginismus and you've had that diagnosis, there are many ways to work with it, both clinically in the medical work and as well with psychological work. So, don't be afraid of that term. There's a lot that you can do. I've seen wonderful cases. Some of my best cases have been through working with clients diagnosed with vaginismus and seeing huge breakthroughs in their ability to not only work through it, but have, what they consider healthy sex. And there's so many, I'm smiling because I'm thinking of the emails I've had from clients saying, I've had a breakthrough or this worked. And I'm just, I thought I was going to have this thing forever. So yes, don't lose hope if you have that diagnosis. It's a big, scary term, but very approachable and reasonable treatment options.
Something I've noticed actually, but I'm learning from you and even seeing some of your videos. I don't know if it's intentional, that's why I want to ask a question. Your choice of words, like I noticed you do not use the word, well, I've not often heard you use the word like dysfunction, like
Mm.
problems, like you mentioned, like you don't like to use healthy a lot because obviously it's subjective. Is that something that's intentional on your part? Because I like how you refer to vaginismus as a sexual concern as
Mhm.
opposed to like a sexual dysfunction, which I often hear. And I myself have used, which now I'm kind of regretting. I'm just wondering, is that a conscious, because it sounds more welcoming actually, as opposed to like saying someone has like referring to it as a dysfunction. Is that something that you do intentionally, or is that part of your training, or just wondering that it just came to mind?
It is, it's intentional and it's also part of training. In my training outside of my mental health work has been, I'm a clinical sexologist. That was such valuable work in my training, which was to see a very sex positive model. And I think when I hear the word dysfunction, it implies something's broken. And I think so many people come into therapy feeling broken. And the last thing they need is this big clinical term attached to something that they're dealing with. And so I think dysfunction also implies a very medical model, that these are very sort of disease-oriented concerns. And as we're discussing today, many concerns come from, traumas or social experiences that aren't necessarily biologically based. So many of our sexual concerns are more sociocultural. So to put dysfunction on top of that, it sort of implies that we are going to go from dysfunction to function, and it seems very straightforward in terms of medical or diagnosing or treatment or take a pill. And I think that it's so much more than that, which is why I have a more holistic model. I think if we look at it as concerns, we normalize it. I mean, one of the things I say often is 100% of us, myself included, are going to experience sexual concerns. I think if we think of it as a dysfunction, we may be more fear-based. We may be more isolated or repressed in our ability to get help or even name what we're going through. So it's absolutely intentional. I think language is so important, especially in this work, because so many people come into this work terrified, right? I mean, I'm going to sex therapy. What does that mean about me? Or what's wrong? Or I'm broken. And I want people to feel empowered and also, normalize the fact that there's these are common concerns that, let's not get scared by the terms. And the terms are scary. Let's face it. I mean, the DSM in the field of psychology used to call low desire hypoactive sexual desire disorder, this big long term to describe low desire. And how many of us have experienced low desire at some point in our life that don't need this big diagnosis to be something we identify with, but let's just call it what it is. Yeah, sometimes your desire can be low. It doesn't mean that something's wrong with you or you're broken. Let's normalize that and let's find a path to help you improve that in your life. So I think it's also a more empowering model to use language that can help people feel motivated rather than, afraid or powerless in their treatment process. I would like to think of my treatment as collaborative. No, you're not broken. And also, you're going to be helping me as I guide you through this process. We're going to work together to meet those goals. I need your input as much as you need mine. So I want people to feel like they have a very active role in their therapy process rather than it feeling like, I'm this broken individual and I have to go see a clinician and it's going to feel very medicalized. I don't want that to be the experience that people have in this work.
Again, wonderfully well said. Touching on your Latino culture and background, and also working with other conservative cultures, I'm just wondering because a number of things that I hear what guys say when we're talking amongst ourselves in our safe place is why do I need sex education when I've had X amount of sexual partners or I've got X amount of children? I don't need education. Is that something that you've come across as well, like where people equate sex education? I think sex education just for children or people have not had any sexual experience. Can you just talk a little bit about, is that true that the more sex you've had, the more you'll know about sex and the better and more educated you'll be? Is that the case?
It's not the case, actually. And I think there is a lot of shame around the idea that, I need sex education, implying somehow that, I know less. And it's not just about, education isn't just more information. People will say that, I know techniques and I don't need to learn this or that. And it's so much more than that. It's about understanding other people's experience. It's about being able to have sexual tolerance for diversity in sexuality. Even though we may not practice something on our own, it's still important for sexual health and wellness to be tolerant of other people's behavior, even if it's just our understanding. We may say, oh, that's not my thing, but I can understand why that may work for another individual. So I think people think of education as, oh, you're going to tell me, how to do sex. I know sex, or, I know, I know all of that already, but it's so much more. It's communication skills. It's sexual empathy, as we named. It's being able to understand someone else's sexual experience, and it's a breadth of things. Anatomy and physiology, understanding the whole spectrum of sexuality. So it doesn't matter what age you're at, you're still getting educated sexually. I myself included. Every day I'm learning something new. That's why it's important, even for my competency as a sex therapist, to keep my education as a sex therapist. So we never get to a level where we know it all. I mean, I know people want to think I've mastered sex and I don't need education anymore, but it's so much more than that. It's evolving and continuing to learn and be tolerant and open to new information around sexuality. So not only you're more informed, but you become a better sexual being by being able to not repress others or feel judgment towards others. I think that's such a big part of our sexual health and wellness too, is that we can be open to other people's experiences without feeling it's right or wrong, and all of the things that we've learned, kind of unlearning a lot of that. A lot of sex education is unlearning things that no longer serve us or reevaluating our values and beliefs that work for our lifestyle. So that's why I think it's important, even when I'm working with conservative populations, is I'm not changing your views on your faith or your background or your culture. I really appreciate and respect that, but let's integrate that into sexuality so they don't feel like these two separate islands over here, but they are integrated into who you are and help you understand your spirituality and selfhood more.
And speaking of people from like a conservative or religious background, spiritual abuse and sexual abuse, unfortunately, is quite prevalent in a number of communities. I'm just wondering what general advice, if any, would you give to someone who is experiencing spiritual or sexual abuse, especially from a religious leader.
Yes, absolutely. And it can be very traumatic to go through something like that and to even name it. So I think it's important that we are able to name it and understand the components of what spiritual abuse is. It can be coercion and abuse. I think what I've learned a lot from conservative communities is that abuse is sort of looked at as maybe the more moderate to intense abuse. But I think we also want to remember that abuse it can be verbal, it can be slight behaviors. So there's a range of what abuse is, and if you're experiencing that, to be able to not only name it but talk about it, whether it's a professional, whether it's someone you feel safe with in your community. What's most important is that we don't ignore what may be abusive behavior, because not only will it help you in your own healing, but it could protect others that are in a potentially dangerous situation from someone misusing their power and authority, or using their position to coerce or hurt others. So it's important that's why education is important, even around understanding what sexual abuse is, understanding all components of abuse and how that fits into spiritual abuse, which may be happening whether in an organized religious group or a community where people are influenced and under leadership, where they may be getting messages that can be detrimental to their own well-being or their families and people around them. So I think it's important that I know it's difficult to reach out for help and support, but remembering that, especially working with a mental health professional, it's confidential, it's safe. We are mandated reporters, but really our goal and our ethics run in providing a space for your healing and being able to help you understand what that abuse is and how to heal from it, how to take the appropriate steps to figure out how to address this in your own life. So it's you are supported, and you will have people around you helping you through that process, even if it feels overwhelming.
And do you offer like services to help or support anyone who's struggling with like abuse? Is that also part of the services that you offer?
Yeah, sexual abuse is a big part of my work. I work quite a bit in trauma resolution, and it can be at any point in life. It doesn't have to be something that's happened recently. A lot of traumas have happened in early life. Some have even been repressed, where we may disassociate or disconnect from the memory or awareness. It may show up in body-based memory. So it's absolutely a big part of the work. I would say the prevalence of sexual abuse is so high in every community, and I'm focusing a lot now in the Latino community, just the stigma around naming it. I know some people will say, I wasn't raped, so I wasn't sexually abused, but I dealt with this or that. So it's really important for me to help people understand how we define sexual abuse, and understanding that it can be anything from harassment to the way someone speaks to you and in terms of your gender, your sexuality, and that extent of understanding sexual abuse will help people seek the help that they need. Because the more we ignore or repress or feel shame around sexual abuse, the more we don't help even the broader society and culture understand this problem. And I think it's a really fascinating time with all these platforms and technology, because we're seeing so much more exposure to abuse on so many levels, from everything from you see what's going on in Hollywood right now, to we were speaking about what's going on in religious communities right now, with leaders coming out and having these cases and allegations. It's the exposure helps us become aware, but we also need to make sure the education is there so people know how to navigate it.
Yeah, I agree. And that's why, again, why I think your work is extremely important, especially obviously in recent times with the recent events of a high profile religious Quran teacher who was arrested for producing child pornography. And say it's a horrific case. And I just think one of the things, because I'm getting a number of messages where a lot of people are concerned how do they process it. And so I tell people that I'm not a psychologist or therapist, but there are people that are available, like yourself, in the community, or people can reach out to online, or if they're in Beverly Hills in person, because I think that's where a number of religious leaders who are trying to do their best, but that's not their field. And
Right.
sometimes what you find is a number of religious leaders, they take the place of being like a counselor or some form of therapist, and they haven't had the necessary training. But because that's the only person that people feel they can go to or they trust, that's the only person that you can confide in. And I'll argue that it can do more harm than good if you're someone who is, I'm just thinking of some of the things that you've said today, like even some of the terms that people use that without realizing it can make someone feel like they're broken, using terms like dysfunction. I'm just thinking of a lot of things that if you haven't had the necessary training and expertise, you can actually be doing more harm than good. And that's why it's important to signpost people to mental health professional sex therapists who are certified like yourself, and they can get the necessary help that they require. I'm just
Absolutely.
interested also, you mentioned about again about the Latino community where I wasn't sure, did you mention that there was pushback in terms of understanding abuse, or is it people are not, is it because of a lack of education? Is that, I'm just wondering, what are the challenges that you're finding in the Latino community in relation to um sexual abuse? And you use the term as well, I wrote it down, trauma resolution.
Yes, yes, absolutely. So I would say maybe a little bit of pushback and lack of education because there is such a stigma around it and not an understanding of what it is. I think there's a lot of sexual abuse that's sort of, swept under the rug, or it's minimized, or it's not really looked at from a trauma lens to say, okay, this happened, let's just kind of forget that it's happened and move on. But look at the repercussions of sexual abuse, how it impacts everything from mental, physical, sexual health. And so that education is important because I mentioned in that example, sometimes people say, oh, I haven't been sexual abused, but I was molested once as a child, or there's such a misconception of what abuse is and trauma as well. Most people will say, oh, no, I've never, even on my assessments, I've never dealt with trauma. And sometimes the education of what trauma is, especially psychological trauma. Psychological trauma can be any strong emotional response to an experience. So it doesn't have to be, what we call big T trauma, this huge catastrophic event. It could be something, it can be one interaction. It can be one experience that shapes your entire, sexual response or belief system. So it's important that we have that education, because if people understand what trauma is and how it affects the body holistically, body and mind, I think that's so important as well. And to your point, why working with competent professionals is important. What we don't want to do with trauma is think that the first way to address it is just by talking about everything that you feel. I work with it very slowly in a very mindful way so that you don't re-traumatize the individual as they're going through trauma work and treatment. So it's important that we understand the stages of trauma. There may be a grief process that goes on first. There may be a numbing and disassociation. We're getting to that place of safety and regulation is important before we even name what's going on in that traumatic experience. So I'm always working on stabilizing first, creating grounding and tools so that when we start to open up about the experience and the narration of what's going on, you have some resilience so that you're not re-traumatizing or harming that client more in their process of healing. So I think that's very important. Anyone working with trauma that works with someone who has that training and basis so that you're not, again, creating more wounding and harm for oneself, and that you have the right path for healing.
And is it possible for someone, well, shall I say again, sorry, is it possible for someone, especially a woman, to can experience pleasure after trauma and abuse? Is that something that's possible?
Maybe extents or levels of pleasure. And what I mean by that is sometimes we can have a very intellectualized version of pleasure where it becomes very cognitive. And what I notice is there's sort of a disconnect from other aspects of self. So they may say, intellectually, I feel desire or I enjoy the experience, but my body's not responding. So I find that we sometimes can develop coping mechanisms in that way to deal with the trauma. And my work is really to integrate that and to help the individual integrate between those parts of self so that they're not using that mechanism and have healthier mechanisms for coping and hopefully better experiences of sex and connection through that process. So I think often too, our measure of what is pleasurable is something that we need education around. Is pleasurable just something, I was able to feel more relaxed during sex, or I wasn't in my head as much, but am I actually getting my needs met sexually? Am I enjoying? Is my body responding? Am I aware of what feels good and what I want to experience? So I think that's why that education is important so people really understand and can be given permission to find out or discover what they want to have as a sexual experience. Like, what do you want to experience? Do you want connection? Do you want intimacy? What are you looking for in your experience? And that's something that I don't define for the client. I always say my version of great sex is very different from your version of great sex. We're here to figure out what you enjoy and what feels good for you. And it's not my job as a professional to tell you what you should enjoy, but to help you come through with that understanding so that you feel more in control. So that's very important with trauma, because I think trauma can also, be not only a stigma, but something that people identify with that leads to more of that broken sense of self. And, so many people, men, women, children have experienced traumas that we need to normalize it. And I'm seeing that happen in my field more, which is great. We're talking about trauma more. Most therapies now are really trauma focused, which is, trauma resolution work is really that. Like, let's make sure we're not looking at trauma as a separate part, but understanding trauma is connected to most of our concerns in mind and body and emotion. So that's important that we understand that.
Just a final question, just around pleasure, because I know you've done some great work around women's pleasure in particular. Can you just help, especially for all the men and the women, but help educate us? Is female pleasure just about the female orgasm?
No, not at all. It's so much more than that. It's a very holistic experience because we can have pleasure from things that are not physically part of our sexual experience, so much, especially the female wiring, and that's why we can have, some people will claim 15 different orgasm types. I see kind of around 10 to 11, but so many different types of orgasms. Some have nothing to do with our physical responsiveness. And that's why I think mind body is important. We can think ourselves off. We can have so many different experiences, which is why our sexual potential and learning what that is such an important part of sexual wellness. So I think if we limit pleasure to orgasm, it feels very mechanical again. Like, okay, there's a goal and I got to get to the orgasm, and that's when I know I've hit the ultimate point of pleasure. And I find that for many people, it's the planning about pleasure that feels the best, or it's thinking about the memory of that great time or connection that feels the best, or it's the creative part of the pleasure that gives the most energy. So it's so much more than that. That's why I get excited. I'm like, there's so much potential. Like, the sky's the limit. There's so much you can learn about your pleasure. And I think also bringing non-sexual pleasure into the concept of understanding pleasure. Like when I hear people say no libido, I don't experience sexual pleasure, but then I ask about pleasure in other areas of their life and they light up. Oh, my gardening, my hobbies. I love cooking a meal. And I'm like, well, that sounds great. Let's bring some of that mindfulness and sensuality into sex. Or why is there such a disconnect? Why does sex feel not as fun as all these great things you're doing in your life that are part of your libidinal expression? Like, I want to bring those two together rather than sex feeling like this thing way over there. I often say how we do things in life is how we do things sexually. So let's not make pleasure a very separate conversation because we're talking about sex. Pleasure is pleasure. It's how we feel good. It's a response to stimulation and sensation. And I think humans are very sensual beings. I mean, we are pleasure seekers from birth. So it's not just about sex. Sex is just one of our outlets to get there. But I love the pleasure conversation because it's, people light up when you ask them about their passions. They're like, oh yeah, I'm happy to talk about what I do on, what my hobbies are, but ooh, sexual interests and desires, ooh, now I feel scared. So my job is to kind of bring in that correlation of how they're both in of the same, just different expressions. So we don't want to compartmentalize sex as this pleasure thing over here that seems complicated. It's not complicated. That's the one message I want women to understand as well. Women's sexual response is not complicated. We've heard all these wild things about it being complicated and difficult and harder. Not necessarily. I think I've actually put out some videos before that say, actually in some ways it's a lot simpler than what we've learned. And that's really my job to help people find that path to simplicity and ease rather than it feeling like this, uphill battle and I've got to figure all this out, 10 different orgasm types. I'm so overwhelmed. I want people to see the simplicity in that. And yeah, pleasure makes us feel good. We're very motivated by pleasure in everything we do. So it's a big part of our mind functioning as well. It's what fires up our dopamine, and we're pleasure seekers. As I said, it's really a big part of our existence.
Wonderful. I'm actually now I'm gonna take that as well about the complex. Not talking about female pleasure being complex. I've used that a few times, so I do apologize. So is it better with the phrasing to I liked how you mentioned is it about simplicity, would you say? How would you, but oftentimes people will compare women's pleasure or women's sexuality compared to men's pleasure, men's sexuality, men generally they'll say it's quite linear, whereas women it's described as being more complex. Now, what word I'm trying to learn from you is a better word to use that is not complicated? Because I agree, it's not doesn't sound nice, but yeah. So if you can educate
Yes.
myself first and foremost,
Yes, yes. I just like to say different. It's
different.
different. And it's going to be different even from female to female. So it's hard for us to generalize and say, here's men, here's women, and here's the different experiences. Everyone's sexual response is different. That's why it's so important for us to do our own work, to understand our sexuality and to learn that process wherever we are in our life. And it's changing every day. That's why I tell people it's not generalized. So people think, all right, here's the fact about my sexuality. But if we give them permission to know, it changes every day. Yeah, my libido is high one day, it's low, it's ebbing and flowing, or sometimes I'm interested, sometimes I'm not thinking about it at all. That's okay. Differences are much more important. And I think that's important for men and women to understand as well. We're not trying to compete and who's sexual response, who's easier, who's harder, what's easier. It's more about understanding, and differences are things that we can work with. Every relationship has differences, which bonds a couple in the first place. So of course your sexuality is going to have, different templates and different ways in which it functions, but our tolerance for differences, I think, allows us to be more tolerant of concerns that show up in our relationships as well. Instead of looking at it as a problem, and I see this happen in sex therapy a lot, a husband or a wife will say, here's the problem over here, I'm here to support, but this is the one that needs to be fixed. It's important for each partner to look at their role in what's going on and not to look at it as, sex is easy for me, sorry it's so hard for him or her, but to support each other, to think of it as a partnered issue. Sex is a partnered issue. It's a connection issue, and it's a lot more complicated than just fixing the physiology. Only complicated in the sense that there are steps to take, rather than it being,
Okay, right. Gone. I just we're actually more or less near the end to be fair, but I just yeah wanted to say thank you for your time, for your expertise, for your brilliance. Like, because I've been blown away from what you've said, and there's so much learning points. And as much as I'm appreciating the nuances and the complexities and the importance of having like mental professionals like yourself, I'm also thinking, okay, even on our title, it's going to be 10 orgasms with a sex therapist. That's how, because of people's minds is very, but hopefully when they dive in, they're actually going to realize it's not as straightforward and in terms of understanding sex. And again, there's so much stuff that you said from the sexual empathy, from the trauma resolution, from even having like the compassion element for narcissists, or understanding their childhood, understanding the addiction. So yeah, thank you for your work. Is there anything that you've got upcoming, or again, I'm obviously going to signpost your website,
thank you.
obviously your Instagram, your social media handles, your YouTube page, but any other events or anything upcoming that you would like to talk about or promote?
Yes, I'll have some great workshops coming next year. So I will be having a lot of new services and workshops and speaking events coming up in the new year. Launching some of my new services. I just did some rebranding in my practice to really kind of move with modern times and kind of help adapt to what people may need. So I'll definitely send you what's going on, my events that will be coming up if anyone's interested in joining. And then in terms of group therapy, I have an endometriosis support group that will be coming up soon. I myself have endometriosis, so I want people to have a place to come and ask questions and talk about it. And that's not a medical space. That's really about group support. So I will definitely send you all the to-dos and things that are happening in case anyone would be interested in joining or even have questions. Even if you are not available for the event and you just just want some more information, I love to be a resource for information for people. So for your audience, feel free to reach out to me. I do offer a complimentary phone consult. So if you're curious about therapy or you're not sure, you're looking for resources in your area, please give me a call. I'm always happy to help people figure out what they need and start you on your healing journey wherever you're at.
And I forgot to add, because obviously we did speak about this when we had the conversation from our institute. You also provide premarital intimacy therapy. Is that correct?
Yes, yes, premarital coaching.
Yeah,
So
coaching. Sorry.
this is for couples that prior to marriage may want to come in and have a toolbox around communication, how to navigate intimacy. It's sex education tailored to the new couples. So helping them kind of step into sex and intimacy in a way that's not intimidating or overwhelming. And this program really came from my work in working with couples that have abstained from sex before marriage and having a lot of trauma after first sexual experience because they didn't have any tools or education. So I thought, what if we actually prevent this by creating some skills and tools and education? So it's been a very great program. And I can also tailor that to the couple. So that's usually what I've done in that program is meet the couple, figure out what their goals are, what they would like to learn and what their questions are, and then create a coaching program. It can be anywhere from 1 to 2 sessions to a more thorough program, depending on what the couple needs. So yes, please reach out if you're getting ready to tie the knot and want some help and support. I think it's very important to have some good tools going into marriage. Marriage is a huge, beautiful commitment, but also a lot to navigate. So we should go in feeling blessed and excited and not overwhelmed. So please reach out if anyone's interested in premarital coaching and support.
Amazing, amazing. And that's all information is available on your Instagram, Dr. Shannon Chavez,
Yes,
and your website, drshannonchavez.com. Is that correct?
yes, yes, it is.
Dr. Shannon Chavez. Thank you very much, Dr. Shannon. It's been an absolute pleasure again. We'll be in touch soon. But honestly, thank you very much for your work, and may Allah bless you for the work that you're doing. And again, it's an absolute pleasure. Thank you.
Thank
Assalamu
you so much
alaikum.
for having me. So good being here.
Okay, let me stop.